name is Barbara Nemko. I'm the County Superintendent of Schools, and it is my honor to be the MC of our program this morning. This is one of those many days that makes me so proud to live and work in Napa, because when Napa sees a problem, everybody gets together to do something about it. Just one quick personal story. We don't think about suicide a lot, but it does touch us. And I lost a childhood friend to suicide probably 30 years ago now. And I knew she was depressed. But in my mind, depressed is sad. Because we use that term all the time. Oh, how are you today? Well, I'm kind of depressed. And I had no idea that real depression was so much more than that.
I want to just say, first of all, my chaplain team are here today to assist you in any way. If you'd like to share with someone or talk with an individual about this topic, the team will be here for you today. Also, I want to introduce Craig Underhill and a very special guest, Aaron, the comfort dog. So let's hear from Aaron. Craig always just kind of shows up, and Aaron's really the star of the show. In this last year, as Barbara said, we've had a couple of suicides in one of the middle school. Edwin Diaz was his name, 14 years old. And then there was Joey Douglas, 15 years old, at Vintage High School. And Aaron responded, and the handler team responded to both those incidents and were tremendous help. And there's not enough to be said about this team and what they accomplish in our community.
It is an incredible opportunity for the college to host just this kind of community event. And in some ways, this Performing Arts Center was built just for this, so it's dear to my heart to see so many folks here. Just a couple quick comments. We have a very safe environment here. We kind of pride ourselves on how safe it is, but normally that's outward facing. So much of the training that we do and the preparation that we do, but there's so much inward facing danger for our students. It certainly has touched our lives here. I've been a president of several institutions, and I unfortunately never escaped out of an institution that didn't have a suicide. We are still addressing this. We're ramping up our information on campus to help students. We have 18,000 enrollments, and so there are many students here with different levels of anxiety and hurt and issues, and we're certainly wanting to focus on that.
By taking action and raising awareness of mental health conditions, we can break down obstacles and improve the chance of recovery. I'm going to kind of break from my notes at this point and talk about, first of all, the suicide recovery or prevention is so important to our society. I heard Barb out there talk about her friend. And it occurred to me that about 3 years ago, my best friend, a guy that I grew up my entire life with, committed suicide. And, that brings such feelings of despair and wondering, what could I have done about that? What could I have done to help? Because 60 days before it happened, he was just like you and me. There was no problem. But in our country, when you need a checkup from the neck up and there's no health insurance, and you need a checkup from the neck up and somebody looks at you strangely or somehow looks down on you.
The sheriff's office, all our law enforcement personnel, our deputy sheriffs, are deputy coroners also. So that means that they have to go out on an almost daily basis and notify family members, relatives and loved ones of somebody's death. It's not the most fun thing that they have to do. They don't look forward to it. They would like not to. As far as I'm concerned, any suicide is too much. So we have some work to do to meet the California goal of 10.2. I'd like to see it go way below that. For me, that represents a little less work that I'm okay with not having to do.
Good morning. It's great to see everybody here. This is a really impressive event and so much needed in our community. I work at the Behavioral Health Services, providing drug and alcohol treatment and prevention to the teens of Napa County. Our counselors are out in the schools, running treatment programs, engaging with the youth all the time, always alert to any signs or risks of suicide. I'm happy to say that in the years that we've been operating, we've had no successful suicides among the youth we've engaged with, nor have we had any attempts. It might be due to the good work, but we know that those youth who are using substances are at a higher risk as well.
You know, like, is it like Wizard of Oz when they show the ball and she can see like what her family's doing and whatnot? I just wish that somebody had shown me like my magic ball when I was a kid, because if somebody told me that I'd have the life now that I have, that I just wouldn't have believed it, because it's like I've made these movies, I've traveled the world, I've been invited to show it on every continent, you know, except for Antarctica, but it's just amazing. You just never know what life is going to bring. Like, you just don't know. And when I hear about the 14 and 15-year-old kid, it just breaks my heart, because it's like, I understand it's hard to be brought out of a place to believe that it's ever going to get better. I know it's really hard to see that, but it's just, you just have to hold on, because you just don't know.
The one thing that I always tell him is, for those of us that can go that deep, you know, in terms of feeling the lows of depression, or at least have the compassion to see and hear other people talk about it, it just means you can go the opposite direction too. And if given a chance, that if you can make it through those dark times, then, oh my gosh, some of the beautiful things that you can experience in life can be extraordinary. And so the barometer of that is extreme. But if you can just hold through and get through it day by day, like Beth, you can share your stories with other people. And hopefully that gives just a little bit of a thread for someone to just hang out. We're not going to be able to save everybody. And my brother was one of them. But especially for kids, to help them through some of those dark times, giving them the tools and at least the courage to speak up to one person in their life is just that one chance for them to keep going. So, thank you.
Not only has Beth and Julie humanized this, but I can't begin to tell you the heartache that we experience, along with family and friends, of the cases of suicide that we respond to. And we probably respond to 99% of the suicides in our city and county of Napa. I'm going to give you just a few examples of some of those that we've responded to. And I have I just started thinking last night, in a matter of just a couple seconds, I could throw together 10 really very quickly. And we've been doing this for 20 years.
We're asking everybody who's struggling to have the courage to ask for help, but I feel it's equally as important for all of the rest of us to have the courage to listen. As a parent, it might be really, really scary to hear that your child is suffering so much that they want to end their life. As a friend or a family member, it might be too much to know that your loved one wants to end their life because their pain is too deep. It's easier to not take this seriously, or to, because we don't know what to do, to sort of ignore those cries for help. But in order to break the stigma against mental health and suicide, we need to be better at seeing people and at hearing people. We need to make it safe for people to ask for help. We need to be better at listening.
One of the things I wanted to say too, when you share your personal story, it is scary because you don't know how people are going to react, and it's scary because you don't know how you're going to react, and you're also kind of reliving it. So even though you're beyond it, it kind of takes you back. So it's been really special for those that have shared their stories today with Julia and Beth. Then I wanted to just point out that Julia is the designer of our Courage Village heart that we really fell in love with. The other thing I wanted to say, how we came up with it, Aldea does mean little village in Spanish. And at the time of the two suicides this spring by the youth, our internal conversations at Aldea, especially from our executive director, Mark Baumschreiber, he would always say that, people see it as a sign of weakness to ask for help, but really it's a sign of courage. And so we wanted to respond to the suicides, and so this is how we came up with Courage Village. The heart is important. Courage, the Latin root for courage is cor, meaning heart. So it's very connected to the name and the symbol. And our hope is that with Courage Village, that we create a village, a community where anyone can speak and they'll be heard. We're always afraid that if we share, that there's no one there to listen, so I agree that listening is equal to being able to share your story.
It made me think about what was going on with these young folks, what their thought process was and what it really meant. So at that time, the supervisor of the unit and I decided to do a little study and see what was really going on with the youth that had been suicidal within the county. And we went back a year and re-interviewed all of the youth that had come into the crisis unit and had been suicidal to see how they were doing in their lives currently, and if we could come up with any common themes. I certainly was very new and inexperienced at doing this, but what we saw were exactly what we see on a national level. There were common themes of loss, themes of a loss of hope, themes of despair. So as I then proceeded to get licensed and become a marriage and family therapist, I really felt like this was something that I wanted to devote my career to. And even through my different jobs in my career, the idea of suicide prevention has always been very important for me. Starting back with that caseload of suicidal teenagers, some of whom I saw every day, because that's what they needed to get through the period of time they were going through in that crisis. You heard from some of the folks that have talked that they had been in psychiatric hospitals, and hospitals are amazing places for people that need that level of care. But when we can keep them in a supportive environment in the community, that's, in my mind, even a little bit better. And it doesn't stigmatize them in the same way and make them feel, I think the one young lady mentioned, feeling even more despair, being isolated away from everyone.
I am Doris Gentry, and I'm here again with Michelle Farhat. And we've been working to bring this conference to you because September is Suicide Prevention Month. And I do want to tell you, I've had over 100 teen foster boys live in my home. And I've had a lot of experience with suicide attempts. I've had a lot of boys that are in despair and desperate and don't know where to turn and don't know what to do. And so they think suicide is the answer. So depression and sadness is real, but in foster care we face it a lot more than other people do. And almost 75% of our children that are in foster care at some point in that path have contemplated suicide or thought about ways to end their life because of the despair and the hopelessness. So what Mary Butler said, listen, listen, listen. What Lee Shaw said, be a compassionate person and talk to others. And what everybody has talked to you today about on our panel and the council is wise advice. And you being here today is just a testimony to your willingness to be that listening ear. Because what I always say with kids that are trying to commit suicide in my house, well, if we can just get through today, tomorrow we'll have another chance. And so often that's the case. So we'd like today to challenge you to make a pledge with us. So do you pledge to listen? Do you pledge to be a safe house? Do you pledge to be a safe person? What do you pledge to do? So my name is Doris Gentry, and I pledge to be available. I pledge to listen. So what do you pledge to do? And that's our question to you today. Will you join us in this pledge? If you will, would you stand up, please?
We're going to say it takes a village. But on a count of 3. 1, 2, 3. It takes a village.
Thank you again to our sponsors, which are on your program, all of the police, the sheriff, the chaplains that were here, our speakers, Aldea, Napa Valley College, so many people. It takes a village, you guys, to do this, to stand up, to buck up, suck up, and make a difference, and that's what you do. God bless you all. Thank you. Bye.